Let's start there with infectious disease specialist Dr. Sumon Chakrabarti. He's in Mississauga this morning. So, Dr. Chakrabarti, this had everyone in a tailspin yesterday. The messaging differs quite drastically from what Canadians have been told. What is your take on what we heard from the WHO yesterday, and then the cleanup that happened a few hours later, trying to clarify the message?
Yeah, I think the cleanup is still going on. To be charitable here, I think this was a conversation that was taken out of context. I think what we're seeing in other parts of the world is some people are getting a certain vaccine, say Sinopharm, not available in Canada, and then trying to get another 2 doses of vaccine to get double vaccinated or get a vaccine that will satisfy some sort of condition on a policy. So that's why I think that that's what that was aimed at. I agree that mixing doses of vaccine is safe. We have evidence for this. We've been doing it, and it works. So I think that that discussion was something that was not applicable to what's happening in Canada.
Okay. NACI, though, has told us that it is safe to mix vaccines. So what do you say to those people who heard that headline and are still very worried? Why has NACI made that determination that mixing vaccines is safe and effective?
Well, we look at, first of all, what we know about vaccines. We also saw what we have some evidence out of Spain, out of England, and also Germany, just showing that you can actually put these 2 vaccines together and you see actually a boost in the amount of antibodies you get. We also know from previous vaccines outside of COVID that this works, for example, with pneumococcal vaccination. So this is something that's safe, and I recommended this to my own father. He got a mixed dose of vaccine, and I wouldn't do that unless I thought it was entirely safe. So I think we have good evidence for this. We've been using it. It's safe, and I think, again, that conversation with WHO was taken a bit out of context, and it might have been a bad headline that changed the connotation of what Dr. Swaminathan was talking about.
Let's talk specifically about Ontario's Waterloo region. They were dealing with high case counts of the Delta variant, particularly relative to the rest of the province. But now they have broken vaccination records this weekend. They're moving on to stage 2. They're in it now. They're only going to be in it for a few days and then likely move into stage 3 on Friday. What do you make of that approach? And do you think that maybe they're going to stage 3 too quickly?
No, I mean, this is what I think that we have to kind of change our perspective to it going forward. We are going to see outbreaks, and we're going to see outbreaks that happen generally in kind of congregate work and living settings, especially where there's numbers of unvaccinated individuals. And that's what we saw in Waterloo. Now, that's the one positive aspect of that is it can be identified quickly and a public health targeted intervention, which is what we saw there. So I think, no, going to stage 3 will be proper for them is because they were able to get this under control. And I just want to remind people, this is going to happen more and more, and this is where now public health targeted interventions can help.
Yeah, 80% of Waterloo now has 1 shot after that weekend blitz of vaccinations. Dr. Chakrabarti, thanks so much for being with us today. We'll see you again soon.